What old methods did doctors use to spot wound infection? Imagine a time before fancy lab tests and high-tech equipment, when doctors relied solely on their eyes and hands to find infections. For centuries, they looked for simple signs that showed a wound was infected. As far back as the years 1430 to 1470, Roman doctors like Cornelius Celsus described for main signs of inflammation. These signs became the basic way to tell if a wound was infected long before modern science. Doctors would first examine the area around the wound for redness, which they called erythema. This redness was a clear sign that the body was reacting to infection. They would also feel the skin for heat and swelling, known as edema. If the skin felt warm and puffy, it meant the body was fighting off an infection. Pain was another key sign. If the patient complained of increased pain at the wound site, it was a warning that something was wrong. In more serious cases, doctors would look for spreading inflammation called cellulitis. This is when redness and swelling extend beyond the wound into surrounding tissues. They also checked for abscesses, which are pockets of pus that form inside the wound. These are signs that the infection has become more serious. Beyond just looking, doctors examined the wound discharge. If the wound produced thick, discolored, or pus-filled fluid, it was a clear sign of infection. They also noticed if the wound was not healing as expected, or if it was healing very slowly without any obvious reason. Slow healing was often a sign that bacteria or other germs were causing trouble. To get more confirmation, doctors used wound swabs. They would take a small sample of the wound surface with a sterile cotton swab, known as the Levine technique. This sample was then sent to a laboratory to grow bacteria and identify which germs were present. This process helped determine which antibiotics might work best. For deeper infections, doctors had to other methods. They could perform needle aspiration, where they inserted a thin needle into the tissue to draw out fluid containing bacteria. Or they could remove a tiny piece of tissue from the wound for lab testing, called a biopsy. One limitation of these old methods was the waiting time. After collecting samples, doctors had to wait days for lab results. During this time, the infection could worsen. They also checked blood tests for signs of infection, like high white blood cell counts and elevated C-reactive protein levels. All these techniques helped doctors for many generations, but they also meant waiting and sometimes missing early signs of worsening infection. Still, these simple, visual, and tactile methods laid the foundation for how infections are recognized today.